Thank you, Stephanie, for that elaborate presentation. I would want to just invite John Mdluli to take us through the implementation of these M&E tools and what you found out at Aurum. Welcome.
Ladies and gentlemen, good afternoon. My name is John Mdluli, working for the Aurum Institute in South Africa. I will be sharing with you some of the experiences that we have learned when we were implementing these M&E tools, but also to mention that the Aurum Institute in Tembisa was one of the participating sites when these toolkits were piloted. So maybe a quick background. In our background, we can actually look at why do we need a community stakeholder in clinical trials. Firstly, we believe that it is important to have community stakeholders participating in clinical trials because it's an ethical obligation, which is really linked to good participatory practice. We also believe that obtaining community stakeholder support into the design and implementation of clinical trial is key, because at the end of the day, this is where activities are happening at a community level. We also want to increase their TB research literacy and disease knowledge, so that as they participate in clinical trial design and implementation, they know exactly why they have to participate in those. And then maybe also looking at increasing their understanding will really address their concern. And once their concerns can be addressed, this will help us to avoid miscommunication and premature closure of a clinical trial. And really, finally, we want to enhance the recruitment and retention through informed study design and implementation that has community input. Maybe moving to the next point, really, it will be to look at why do we need monitoring and evaluation activities. Firstly, we would like to demonstrate the impact or the value of community stakeholder engagement into the clinical trial outcome, of which recruitment and retention are actually regarded as one of the clinical trial outcomes. We also like to influence the donors and researchers' willingness to support the community engagement activities, and also to involve communities at a very early stage during the trial design and implementation. And because there's been quite a lot of questions around the value of community engagement at a site level, we also like to use this evidence-based tool to systematically evaluate and report on community engagement activities. And then finally, we would like to track all community engagement activities, and we believe that this toolkit really offers us a space to do those activities. And then maybe this schematic diagram is trying to take us through the entire process, where we're looking at work plans, and then maybe planning specifically for the monitoring and evaluation, and then implementing monitoring and evaluation systems, looking at the results, analysis and interpretation, and finally compiling a report. I think Stephanie, in her presentation, she did mention that one of the requirements expected from TB Alliance amongst all the recipients of the CE grant was actually to use the M&E tools to compile the report. So in my next slides, I will be taking you through these different phases. Firstly, with regard to work plan, what we have tried to do is that by the time these toolkits or these tools were adopted, we had already submitted the work plans to TB Alliance. So what really needed to happen was to look at how do we align this M&E toolkit to the work plans already submitted. And in order to do that, we had exposed our community engagement team to the GPP guidelines for TB drug research. So because the two are interlinked. And also what we did, which is currently a limitation when it comes to TB treatment drug, it's a lack of blueprint on how to implement these guidelines. So fortunately, within the HIV prevention field, there's a blueprint which really kind of guide us on how these guidelines can be implemented. Then we made use of those we made use of the blueprint to actually adopt the GPP guidelines on TB treatment. And lastly, we looked at the importance of incorporating M&E into the existing work plans. Regarding the progress of implementing the M&E toolkit, I must say that as of February this year, it became compulsory that we need to make use of the toolkit. And that was then followed by the training on the webinar training, which was conducted on the 1st of March 2016. And then amongst all the 11 tools that the previous speaker has spoken about, we are actually looking at the capturing plan. And I must say that with regard to the AA tools, these are captured on a weekly basis. And then regarding the A3 tool, which is slightly different from other tools, so this is captured on a monthly basis. And then we've got those tools that need to be captured on a quarterly basis, which is your stakeholder interview tool, or also known as B1 tool, or the CAP member interview tool, also known as the B2, and the B3 tool, which is your broader stakeholder interview. And then regarding the last two tools, which are also known as the D tools, those are captured annually. And firstly, they look at the self-assessment of the person responsible to do community engagement activities at a site level, as well as the assessment of the PI, which is your D2 tools. Regarding the implementation process, then we also looking at 6 steps on how this can be implemented at a site level. Firstly, we looked at step 1, which is a data source, and we kind of agreed to say on the type of data that needs to be collected at a site level and why do we need that data. And then step 2 really looked at the personnel, which are the people who are responsible for the data entry, and where will that data be collected, and how often should we collect that data, and which tools to use. Step 3 was basically, I will say, a very straightforward step, in the sense that at the end of the day, this data need to be captured in a system. And fortunately, as we enter in the data in the system, it automatically gets captured. But at the end of the day, we also need to look at who has access into that data. And analysis is done online, which is automatically as well. But what was important for us to look at was that how regularly do we look at that data? Because sometimes poor data entry might actually negatively affect how the reporting will be done. And then step 5, it was the question of looking at the reporting, and we felt that these tools can actually be used to compile reports that goes to a sponsor, and they can also be used to provide feedback to the site leadership. And finally, really it's about application. Application in the sense that how do we then make use of these tools to make decisions, monitor progress, identify areas of excellence, including challenges, and how does, once we have that has all be done, how does it influence the decision making moving forward? For each and every program, in most instances, there's always going to be challenges, and one of the challenges really, like I've indicated, that the implementation of this tool has recently been introduced, is the alignment between the usage of the tools with the work plans. And secondly, there are about 11 tools in total, but because of certain ethical consideration, we are not making use of all 11 of them. Instead, we are using 8 of them, with the exclusion of 3 tools. Finally, I mean, one of the challenges which we have identified is implementing a web-based system like this MNE tool in a resource-limited country can be a challenge because it really relies on internet connectivity. And in situations where where you don't have access into the internet, it might be a challenge to make use of this system. However, there are suggested solutions in terms of how this can be addressed. Firstly, really is the question of looking at how do we align the MNE toolkit with our currently existing work plans. And then we really need to look at addressing the challenge of not utilizing all 11 tools with the exclusion of the 3 to say how do we then make use of all the 11 tools that are available. And then finally, in a situation where there are challenges related to internet access, there's always manual entries that can be utilized and maybe transfer the information to the web-based system as soon as internet connectivity becomes sorted. On that note, ladies and gentlemen, I would like to take this opportunity to thank you all for listening to me.